In this video, we're going to talk about hypertrophic cardiomyopathy. So cardio means heart, myo means muscle, pathy means disease. So this is disease of the heart muscle, and there's three main disease types. There's restrictive, there's dilated, and then there's hypertrophic cardiomyopathy. And in this video, we're talking about the hypertrophic version, where the actual muscle wall is getting hypertrophied or increased in size. It decreases the size of the chamber, so you don't get the adequate filling that you need during diastole, and hence it's called a diastolic dysfunction or a diastolic heart failure, because you're not getting the adequate filling that you need. So your preload is down, which means that the amount of blood that gets pumped into your systemic circulation or your pulmonary circulation is not going to be adequate. So it's going to be a decreased outflow. So let's look at left ventricle first. So if the left ventricle becomes hypertrophied, your signs are going to be left ventricular failure if it gets significant enough. You may not notice this for a while, but then it might get to a point where you start to have decreased cardiac output. And so if you have decreased cardiac output to your brain, that's going to result in lightheadedness, syncope, or fainting. If you have decreased output to the heart itself, you could have some chest pain, especially upon exertion. If you have decreased output to the muscles and just the body in general, all the tissues, you're just going to be fatigued. So that's some of the signs you would get with left ventricular heart failure secondary to significant hypertrophy of the myocardium. So another one, anything that makes the ventricle work harder is going to contribute to the size of the ventricle. So hypertension. So if you have this afterload, this increased pressure in the systemic circulation, that means the left ventricle has to push harder to get through there. And so that's going to build it, just like if you're working out in the gym, your muscles get bigger. This muscle is getting bigger. It thinks it's helping to get that pump stronger, but it only works for a little while, and then it starts to get too thick and start to encroach on that chamber, inner chamber. Another one is aortic stenosis. Imagine that these little valve leaflets are calcified and they don't open very well. You're having the heart has to push extra hard to get that blood into the aorta. So that could be another cause. But a lot of times it's just genetic and it's autosomal dominant. So that means that if your parents have it, you have a 50% chance of having it. And a lot of times the genes are genes for sarcomere proteins, like aspects of the myosin and stuff like that. So that's left ventricular hypertrophy. Let's talk about right ventricular hypertrophy. And a lot of times this is caused by pulmonary hypertension. A lot of times you have cor pulmonale, which is some kind of lung problem like COPD, like emphysema, chronic bronchitis, something like that, that's increasing the pressures in the pulmonary system above 25 millimeters of mercury. So that would be considered pulmonary hypertension. And that's a cause of right ventricular heart failure because it has to push harder and add muscle to try to push through the pulmonary valve and into that pulmonary circulation. And if we had a pulmonary valve coming through here, again, if you had stenosis or calcified leaflets on that valve, the right heart would have to push harder to get the blood into the pulmonary circulation. So it's going to get larger there. Sometimes the left heart can back up into the pulmonary system and cause congestion and increased blood pressure there in the pulmonary system. So left heart failure from left heart hypertrophy could eventually lead to right heart failure. So sometimes that one comes first before this one. And then let's talk about diagnosis. If you're going to diagnose this, the best way to diagnose this is with the echocardiogram, because you can actually see the size of the actual myocardium, whether the left ventricle is loaded up there or the right ventricle or both. And then how you treat this is you want to prolong the filling time and get as much blood into the chambers as you can. So the first line is always beta blockers. This would be like metoprolol, atenolol, propranolol. Those are common beta blockers that are used for this. If for some reason they're not tolerated well, you can use some of the calcium channel blockers that actually address a longer filling time So Verapamil and Diltiazem are two of the calcium channel blockers that kind of delay the heart rate a little bit and allow that filling time to increase and try to get more preload in there to help the situation out. If medical treatment can't work, then there's some invasive measures like septal myectomy, which is an open heart surgery where they go in and remove part of the muscle. A lot of times it's right here in the septum that gets real thick, and that septum can block the outflow, obstruct the outflow, and when it does that, it actually facilitates the movement to regurgitate into the left ventricle. And so if you can go in and actually remove that extra tissue and remove that obstruction into the aorta, then that would be helpful. And then another thing they can do is ablation, a septal ablation, where they go in with a catheter and shoot some alcohol ethy within the capillaries that feed certain areas of the muscle, and in a sense cause that muscle to infarct and kind of decrease in size over time. And then another one is an implantable cardioverter defibrillator, so ICD, and that can be used if this can result in arrhythmias, and it can be life-threatening arrhythmias, and having that ICD in there can help if something like that comes up. In fact, if it's a genetic situation and you have a kid playing sports, this is the leading cause of sudden cardiac arrest with sports. And so it's important to figure this out early. So I hope that helps you understand a little bit about the pathophysiology of hypertrophic cardiomyopathy, the diagnosis and treatment.